customs was about 3 hours, got through, flight canceled from Toronto to Boston. All right, at this point now I go and I see there is a 400-person line with 2 Air Canada workers. There's 1 million canceled flights, so everyone's just panicking. So I waited in that line about 6 hours. Near the end of the line, by the way, you know how much my feet hurt? Near the end of the line, they closed it. They just said, oh, you have to go somewhere else. We had to re-enter Canada. We had to go through Canadian customs. So by the time I finally see someone from Air Canada, it's 1 a.m. I said, can I just get my bags? I had a ride to Buffalo all set up, and I had a JetBlue flight from Buffalo. I just need to get out of this country, out of this airport. This is the worst airport on earth. I'm telling you, there's no other airport like this.
The epic problems at Pearson Airport put into these words, now viewed over 2 million times, after former NHLer Ryan Whitney experienced the frustration felt by thousands of others firsthand. Welcome back. As rules and restrictions continue to relax, people clearly want to get back out there and explore the world in a way that just hasn't been possible since March of 2020, when travelers scrambled to get back home and the pandemic panic really started to kick in. But Canada's busiest airport has struggled to keep up. Long lines looping through Pearson as delays and canceled flights force travelers to wait for hours on end.
The situation at the Toronto airport is unacceptable.
The havoc erupted in April and May as demand for travel increased. The airport said travelers were experiencing longer than expected wait times at security checkpoints. Those checkpoints are manned by the Canadian Air Transport Security Authority, which blames the delays on staffing shortages. The Tourism Industry Association of Canada says the entire industry has been hit by
a mass exodus of staff during the pandemic, when we were closed down, when our borders were closed.
Some business leaders and airport officials also blame the delays on continuing COVID restrictions.
We've removed COVID testing from airport premises, and we are addressing procedural bottlenecks.
The Transport Ministry responded by suspending mandatory randomized testing of incoming travelers until July 1st. When it will come back, but at off-site locations away from airports, allowing testing areas inside terminals to be dismantled. The feds also ended the vaccine mandate for domestic and outbound travelers, but the mandate remains for those entering Canada, and the ArriveCan app still needs to be used.
Really, we need to see all vaccine mandates lifted for all international travelers.
Beth Potter from the Tourism Industry Association of Canada says removing all mandates is needed to improve wait times and allow the tourism industry to rebound to pre-pandemic levels. She also wants the use of the ArriveCan app paused during the busy summer season.
All of the questions that are being asked on the ArriveCan app are also being asked by border officers, so we need to streamline the process.
But it's still going to take a while for the travel and tourism industry to rebound. Potter says domestic tourism numbers are expected to rebound by the end of 2023, but pre-pandemic levels of international travelers are not expected until the end of 2025 or even 2026.
It all will depend also on if there are future waves and the government decides to enact restrictions on our industry again.
Border towns like here in Niagara Falls have especially suffered during the pandemic. That's because American day trippers and travelers were no longer spending their dollars here. Before COVID, 10 million Americans crossed the border every year for day trips. The Tourism Industry Association of Canada says this year, it's about half that. The city's mayor says they need more Americans to come over and spend their dollars. Jim Diodati says normally 50% of all revenue coming into the town comes from the U.S., and it's way below that now.
A lot of Americans are avoiding Canada altogether. They want to come, but they feel that Canada's been closed to American tourists.
Pandemic was devastating, not just for the industry, but for us as well. We were virtually closed down for 2 years with very limited operating capacity.
MORY DIMAURIZIO of City Cruises Canada says in 2019, they had 2.5 million people take their boat tour of Niagara Falls, but in 2020 it was less than 100,000. This year, they're forecast to hit about 1.6 million. He says the ArriveCan app needs to be scrapped for now because an unfamiliarity with it is stopping Americans from coming over. But even if that happened today, he says the benefits won't be reaped until next season.
Middle East, Far East, Europe, South America, Australia, folks in the U.S., when they plan to go on vacation, they plan in January, February. Those people have already gone on their vacation. They've already made their plans and paid their deposits, so they're not going to change gears just because the ArriveCan app has made a change.
Compared to the ghost town the Falls became in the months after the pandemic began,
The crowds have started to return to Clifton Hill, despite the lingering risk of illness.
I kind of worried when I was initially decided, but now it's when I came here, it's very good.
The worry's just not there as much anymore. I was confident to come.
It actually feels pretty normal. Like once you go to the first dinner or the first thing, then you kind of get back into what life used to be like.
Most are from within Canada, but some are here from overseas, like these students from England.
With vaccines and everything, and I think we are a lot safer now.
For more analysis on this, I'm joined by Dr. Zane Chagla from McMaster University. Doctor, thanks for being with us. What do you think of the government's decision to end the vaccine mandates?
Yeah, I think it's a welcome change. Vaccines do a great job at preventing people from getting critically ill, sick, hospitalized with COVID-19. But we do know with Omicron, the effectiveness of a vaccine for preventing symptomatic infection has significantly reduced. And, you know, that really means that environments like airplanes, where we think vaccines would make them safer, aren't really getting a lot of benefit from it. Recognizing that really is keeping people from their families, from travel, from employment. And so, you know, when the science changes, so should the restrictions that come in place with it. And, you know, it's welcome that people can enjoy freedoms, not based on their medical decision, but based on the science.
And what do you think of the government's decision to keep the mandate for people entering Canada?
You know, I think this comes from making sure that individuals who enter Canada, especially people that aren't Canadian, that aren't, you know, eligible for healthcare, aren't overwhelming hospitals if they were to get sick here. But at the same time, you know, those individuals, you know, often a lot of them have already had COVID, and so the risk of getting very sick is very low. We still have treatments available for people if they do get COVID. And, you know, risk is very different. An 80-year-old with multiple medical conditions still has a higher risk of being hospitalized with COVID if they get it here as compared to a 20-year-old that hasn't had their vaccines. And so, you know, I think we really do have to think about letting go of vaccination as a point of entry to Canada. And that really follows many other countries around the world who have really left it as, you know, come into our country and not necessarily having to be vaccinated or tested while coming in.
You know, I've heard a lot from businesses in border towns, others that think the ArriveCan app is making it difficult for a return to tourism. I'm wondering, do you think we still need to be using the ArriveCan app?
I mean, I think as we get rid of these restrictions, really we should be getting rid of the bureaucracy associated with it. This is not of zero cost. It is, you know, difficult for elderly and other individuals that aren't necessarily as tech savvy to navigate. And again, if we're not going to require vaccination, which should be a part of this, if we're not going to involve testing, then we should really let the border be open and not necessarily introduce more than the typical customs that people would have to go through to come into Canada.
And as we kind of move forward into the future, where do you see the role of vaccines around travel continuing, or is that just something that we're eventually going to completely move away from?
Yeah, I think we move away from it. Look, the world has seen a lot of vaccines. The world has seen a lot of Omicron. The disease has hit the lowest deaths that it's seen during the pandemic for some time. And so, you know, I think as we get to that point, we have to start saying, what is a sustainable solution going forward? And not necessarily mandating vaccines, encouraging vaccines as they would for normal travel, but not using them as a way to define who can enter your country and not.
Also complicating travel plans, major problems at the passport office. This is the scene that's been playing out daily at the Service Canada location on Upper James in Hamilton. People securing their spot in line before sunrise, only to be turned away unsuccessful.
I'm honestly appalled, and you could probably physically see it in my appearance. I am sunburned, I am exhausted, my eyes are bloodshot. And I don't think it should have taken 20 hours to renew a passport.
Well, this is my fourth attempt to get a passport. I came here at 7:40 this morning. I've been waiting all day, and they kept coming out and giving us the impression they were going to serve us. And then the guy just came out and said, we're locking the doors.
I am planning to camp out, so I need to get this done and over with after waiting today in the sun, in the rain, and sun again. I just want to get this over with.
The federal government says a significant surge in applications since travel restrictions began to lift is fueling this passport predicament. Officials are now working to hire hundreds of additional staff for Service Canada locations to help bring this situation under control. For those staying close to home, even those road trips are proving more complicated and costly thanks to the painfully high price of gas.
We do normally travel and try to go do stuff, even something just as simple as Canada's Wonderland. But again, it takes almost an entire tank of gas to go and do something like that, and it eats the cost, so it's not worth it in the long run.
There's so many places I want to go, and I'd love to travel down east, but every time you think of a destination, you have to factor in those gas prices, and that really does, make me more inclined to stay at home.
We're planning to still go to a cottage in July. We're still going to do it. I mean, I can't stop family time and fun, but does, hit the wall a little bit, that's for sure.
Despite some ongoing challenges, a return to travel is just one of the ways we're getting back to this new sense of normal, but other pandemic habits may be sticking around.
If I go out to grocery stores, do any personal shopping, I still wear a mask. I still think it's the safest thing to do.
I still wear a mask basically everywhere I go indoors. Even though I myself have had COVID, I still like to take the precautions, but I've noticed that most people have just dropped it.
If somebody asked me to go into their store, or if that was something that made them more comfortable in their presence, I certainly would. I wouldn't debate it. I wouldn't challenge it.
For more on people's changing behavior during the pandemic and if those changes are going to continue and for how long, I'm joined by Clifton van der Linden. He's a political science professor here at McMaster University. Clifton, thanks for joining us. You're behind the COVID-19 Monitor Project. Tell me a little bit about that.
So since March 2020, when pandemic lockdown measures started to come into effect, we've been surveying Canadians on their views about the pandemic itself and pandemic-related policy interventions. We've now conducted almost 50 iterations of that survey across the course of the last 2 years. We have more than 100,000 Canadians who have participated in the survey, and it's given us the largest data set of public opinion among Canadians that we know of. Gives us some real insight into how Canadians are responding to the changing dynamics of the pandemic.
Everybody talks about masks, so I'm wondering what that insight is on how long you think people will wear masks and what would cause them to stop.
So we've seen that people have been really responsive to government mandates. So when the government relaxes restrictions on masking, even though masking is still a suggested protocol, by and large, you see the public largely drop any public health precaution that is not mandated by government or public health officials.
Okay, and what do you think about things like going out in big crowds, social distancing, those kind of other learned behaviors that we've adapted? Do you think those things will continue despite the end of restrictions?
So I think a lot of this actually falls on political lines, and it's an interesting dynamic. So things that are seen as sort of scientific, evidence-based backed measures have now become politicized. And so you see people wear masks or socially distance more as a signal of their political views and values than of actual adherence to public health advice, and particularly the rejection of these symbols. These things have become symbols instead of medical precautions, and the politics of it has really split people apart in terms of what they're willing to do and what they're willing to not do.
That's a really interesting discovery, that this is less about medicine and more about politics. What would your research say about people's comfortableness traveling outside of the country now that that's becoming more of a reality?
I mean, both in the public opinion data and in the news that we see from airports across the country and across the world, we see that people are really, by and large, out traveling again, out gathering in large crowds, and I don't see that trend dissipating because the public health advice or the public health guidance and the government policy on these matters has sort of been completely relaxed, and I think it would take a real sense of a resurgent crisis for the government to be able to marshal the sort of political capital necessary to reimpose any of these mandates.
When we come back, managing misinformation, where we go from here in the face of division and distrust.